My name is Francine Maxwell. I'm the NAACP San Diego Branch President, and I want to thank everyone for spending their afternoon with us to get some wonderful information in reference to climate. So the NAACP San Diego Branch, we're celebrating 102 years here in San Diego, fighting for civil rights. Our theme this year is Rise to the Challenge, Answer the Call. So again, I want to welcome everyone and thank you for spending your afternoon with us, a small part of your afternoon. And I'd like to introduce you to our chair of the Environment and Climate Justice Committee, Jackie Clark.
Thank you, President Maxwell, and welcome again, everyone, to this very exciting and I know it's going to be very informative presentation by Dr. Wilma Wooten and Dr. Cheryl Anderson. So I just got a few housekeeping rules we're going to go over really quick. I already told you to drop your information in the chat. We will take like a brief break. It's not a real break. It's just for you to be able to get up and stretch, move around, have some movement. We do have a very tight agenda. And so we're going to be moving very, very pretty much on time as much as possible. And I'm going to go ahead and introduce you to our first panelist today, and it's Dr. Wilma Wooten. And she is a public health officer for the County of San Diego and the Health and Human Services Agency. She received both professional degrees from the University of North Carolina, Chapel Hill, followed by the completion of residency training at the Georgetown Providence Hospital Family Practice Residency Program in Washington, D.C. In 1989, she completed the Joint San Diego State Graduate School of Public Health, University of California, San Diego Preventive Medicine Residency with an emphasis in sports medicine. Dr. Wooten practiced medicine as a faculty member in UCSD Department of Family and Preventative Medicine from 1990 to 2001. She remains a UCSD volunteer associate clinical professor and is an adjunct professor at SDSU GSPH. She has been with the County of San Diego Health and Human Services Agency since 2001, initially as the Deputy Health Officer, and now serves as the Public Health Officer since February 2007. She has a strong interest in health disparities and health equity. Dr. Wooten is a past board member and past president of the California Conference of Local Officers, current board member and past president of the Health Officers Association of California, past member of the advisory committee to the Director of Centers for Disease Control and Prevention, we know it as the CDC, and past board member of the National Association of County and City Health Officials. Dr. Wooten is a current board member of the Public Health Accreditation Board of Directors and the chair of the FAB Accreditation Committee. She is also a member of the Big Cities Health Coalition and currently serves as the chair. Was important for me to read the bio so that everyone who is not aware of who our panelists are has a good idea of their background and why we are super and appreciative and excited to have them speak. So without further ado, I'd like to introduce you to Dr. Wilma Wooten.
Well, thank you so much, Jackie, for that thorough introduction. And thank you for inviting me here today to talk about this important topic, which is climate change. I think it's one of the most important public health issues. You know, everything in public health is important, but this really is important from the standpoint of its impact on the lives of everyone in our nation, both currently and for generations to come. And what we do today will impact what our generations experience in years to come. Going on to the next slide, I just want to quickly share with you, what I'm going to talk about today. And the graphic on the left was placed in just to remind you that this year in 2021, the United Nations issued an intergovernmental panel on climate change. This new report has the latest health check for our Earth's climate. And there's some grim information that's included. And hopefully it will be information that will help wake up our nation, our politicians and policymakers. The items that I'm going to discuss today, there's 7 items, but there's 7 sections, and it's going to be quick. So the first is basically just to talk about the problem and the issue of who's at risk as it relates to climate change. Then I have 4 specific areas that are public health related: heat, wildfires, air quality, and vector-borne diseases. And then the last 2 sections, what has the county been doing to address this issue locally? And then what can you do as citizens to make an impact? In the next slide, set up for our next section. So that is, what is the problem? Now, these are, and I'm sure many of you may not be aware who these people are, but on the left side, that is Dr. Georges Benjamin, who's the president and CEO for the American Public Health Association. Actually, APHA was held here in San Diego a couple of years ago. During my tenure with the county, it's been here twice. So it's important to have all of these public health professionals convene in San Diego. Also on the, on the right side is George Benjamin's. On the left is Margaret Chan, who's a Director General for the World Health Organization. And the point of including these 2 entities is that climate change is being acknowledged as a world and national public health crisis. So these 2 leaders consistently indicate that this is an issue. And simply put, they make the statement and the case that climate change is bad for everyone. If we can go to the next slide, this is what I call a slide, a money slide, but if there's one slide you can take from this entire presentation, it's that the public health impacts related to climate change. This slide is actually from the California Department of Public Health, and it sums up the major impacts of climate change on health. We understand that these various factors will be experienced in varying degrees here in San Diego, as well as throughout the state and throughout the nation. The state of California conducted an assessment, and in the next slide, we'll talk about that. But the top 3 issues that were identified specifically for San Diego County was heat on the left side, then air quality, followed by vector-borne diseases. And in the next slide, again, the question is, who is at risk? And simply put, everyone. The very young, the very old, those individuals that might have mental health issues, people that are homeless, individuals that are pregnant, and even people that are isolated, either socially or geographically. No matter what your situation, everyone is at risk due to climate change. And going to the next slide, as any local health department addresses climate change, the first step is to identify the risk and the vulnerability. So the California Department of Public Health several years ago developed a risk assessment for all of the 61 local health departments in the state. And San Diego County's risk was scored relative to the other counties in the state. And you'll see here that in this assessment, heat and wildfires were identified as the 2 highest rated risks, risk of vulnerabilities for individuals in San Diego County. Now, in the next slide, the vulnerability assessment was part of what's called CalBrace program, and I'll explain that in another section, but we'll be explaining that shortly. Contributing to the problem, there were 3 conditions that were identified in this vulnerability assessment that I referred to that was conducted by the state. And the 3, number 1 was populations living in very high risk fire hazard zones. So that has the greatest risk and vulnerability. The second two are similar, but it includes areas with impervious surfaces. Basically, those are areas that have a lot of concrete and no trees. And then the third, which supports the second, is areas with no tree canopy coverage. And if I could make a suggestion, if the NAACP wants to do something, this is a simple thing to do, but ensuring that there are trees planted in locations, particularly in the inner city locations, I think would be a very noble task for an organization such as yours to take on. So those were the three populations and high risk vulnerability states that were identified for San Diego. And they were identified as our highest risks because our percentage was higher than the overall state average. So that's how those three were identified. So now we've identified what the problem is. Let's go into the next few sections. The next 4 sections are going to be the specific issues that we want to address here in San Diego and that we are addressing. In terms of heat, since 2006, when that huge heat wave spread across the US, many people died. The county, with Public Health Services having the primary role, developed an excessive heat response plan. And in July 2006, this was an unprecedented situation, and quite frankly, deadly. 450 to 600 people died in a few days. 16,000 people were admitted to the hospital, and over 147 died specifically from hyperthermia. And all other deaths were due to exacerbations of chronic diseases such as heart disease or asthma or things of that nature. If we can move on to the next slide. What I wanted to share with you was a summary of the heat alerts as part of our response, our excessive heat response plan. Whenever there is a specific, particularly excessive heat warning, we activate our plan and we bring all of our internal and external partners together to execute the plan. So we also have the response plan, we have a ConOps plan, and we have a consumer version of this plan that you can find on the website. And if it's not in the PowerPoint, it may not be in the PowerPoint presentation itself, Lily can send you that link. We just actually updated those 3 documents last month. So they are fresh and off the rack and have the latest information. And we have a lot of historical information included. Now, this table is as of June 14th, several months ago. And I can tell you, we're looking at the heat alerts, and you can see that from 2012 going up to 2020, the number of heat events or incidents have increased over time. Now, so far this year, as of June, it was 2. As of today, that number is approximately, I believe, 7. So it's not as high as last year, but the year's not over yet. We are still in October, and in the past, we've had some issues, heat alerts in November. So, but the important point that this table drives home is that over the years, the actual alerts have been increasing. And again, that is all due to climate change. So if we can go to the next slide. What I want to do here is just emphasize the fact that heat is one of our top climate issues of concern because it is a threat multiplier. And particularly for those people that have chronic diseases, those that are at increased risk have pre-existing and chronic conditions that will place them at greater risk for having complications due to exposure to extreme or excessive heat. So while we don't have time to go through each of these, they're explained in the slide. I just want to drive home the point that CDC estimates that in the United States, on average, almost 658 people per year die directly due to heat. And that's a huge number. So I think everyone can play a part in doing their role to ensuring that we have a decrease in these heat alerts that occur each year. In San Diego County from 2006 to 2019, we had 2,733 heat-related illnesses where individuals visited the emergency department. And we had 440 people who were hospitalized and 40 deaths. These numbers have increased in the 7-year period from 2013 to 2019. Now, if we go to the next slide, the excessive heat impacts, as I stated, focus on those individuals with chronic diseases. So naturally, there are going to be key organs that are impacted. Obviously, the brain, the heart, the kidneys, and even the lungs. And pre-existing and chronic conditions exacerbate these risks. And people can be at greater risk because they are in isolation, the elderly, those individuals that are in poverty or homeless. All of those factors contribute. Looking at this next slide. Now, what I want to drive home here is that this slide is provided to show that California has most of the burden in the United States when assessing the impact of excessive heat-related illnesses and hospitalizations. So there are 5 basically metrics here: all-cause hospitalizations. So hospitalizations from all causes. California is the leader across most of the states. Well, all is the leader in the United States. When we look at all-cause cardiovascular related hospitalizations, again, California is number 1. We are only number 2 to New York when it comes to respiratory related hospitalizations. And then California is missing there, but that first histogram or bar there is also California, and that's related to diabetes related hospitalizations. And last, fluid and electrolyte disorder related to hospitalizations. California is the nation's leader. Okay, now the next slide I want to talk about is when we have our heat alerts and our heat incidents. The county makes information available to the public. If people don't have air conditioners, they can get them from our Aging and Independent Services department. These air conditioners are provided through a partnership with San Diego SDG&E. But keep in mind that a fan, well, let me just back up a bit. It's not the air conditioner that's provided, it is a fan. But what this is a study that shows that as of 2020, only 45.2% of San Diego residents had an air conditioner in their home. So there are no current programs to give people air conditioners, but I think that is a factor that plays a large part, because usually in our messaging, we tell people to go to locations where they can have exposure. So that what has created the cool zones that we have in San Diego, which could be libraries or malls or public facilities that have air conditioning. Now, the second dot point, 12.8% of residents own an air conditioner unit and 32.4% have central air conditioning. But again, this is a critical factor. Now, what I was talking about, the partnership with SDG&E, what we provide are fans through our Aging and Independent Services. But I want to remind people that fans don't help when the temperatures are above 90 to 95 degrees. And I'm sure some of you, when your air conditioner has been out, may have experienced that. It's just like circulating hot air. So I just wanted to bring that up. All right, let's move next to wildfires and smoke. So excessive heat obviously can lead to wildfires. A lot of time that is what the issue is. And this occurs because our temperatures are extreme, but there are other things that are contributing factors. Power lines or sparks, any spark, like from a car or backfiring of a car, can contribute to starting wildfires when we have excessive heat. And this particular slide just basically shows that in 2019, there were 5,489 fires affecting almost 156,000 acres. If we look at a 5-year average here, there were 6,544 fires affecting almost 740,000 acres. But if we look at just the year, last year alone, 2020, exponential increase, 8,155 fires impacting almost 4 million acres of land. So I don't know what more evidence people need, or politicians or policymakers need. Climate change is real, and it has had a real impact in our lives and in our communities. Now, on the next slide, not going to spend much time on this, but just want to show you that on the state of California, Oregon, or rather, yes, Oregon and Washington, there were many fires that occurred in these Western states last year. So, and again, I spoke earlier about people that have chronic diseases. The air quality is really important, and we're going to talk about that after this slide. This is the next great setup. So if we can go to the next slide. Thank you, Lily. So while national air quality has improved since the 1990s, with many challenges still remaining, however, in protecting our public's health and the environment from air quality due to wildfires. Wildfires are known to be a substantial source of particulate matter. I don't know if many of you remember the fire from 2003. I was in actually Sacramento at a CCLHO meeting. When I came into the airport, it was snowing. It looked like it was snowing, but that was large, just basically ash in the air, but it really looked like it was snow. And when I arrived at the airport. So fires, those are large particles, but there are also smaller particles called particulate matter, which are approximately 2.5 micrograms. And that information could potentially, they're dangerous to our lungs and can trigger worse health problems for people that have asthma and heart disease. And also there is emerging evidence that these particulate matters have been linked to premature births. So in San Diego, as stated earlier, air quality has been improving since 1990, and particularly in San Diego, we usually enjoy really good air quality, but at times the air quality has rated poorly on 9.6% of the days in 2018. Now, air quality is reports are generated by the Air Pollution Control District, and they are posted on a daily basis. And you can just Google Air Pollution Control District, or APCD, and you can see what the air quality looks like today, for instance. But it will be yesterday because there's a 24-hour delay. But most of the times we have a pretty good history here in San Diego. But like heat, air quality from vehicle emissions, ozones, or wildfires complicates existing chronic diseases. Again, heart disease, asthma, and any other pulmonary conditions like COPD or chronic obstructive pulmonary disease. Now going to the next slide. This slide has been provided to just show you how the lungs and other organs are impacted. Large wildfires are becoming, as I showed in a prior slide, more prevalent and widespread, and particularly in our western states. As the large wildfires become more widespread, the smoke from the fires, that's really what causes the impact to individuals that have chronic diseases. Warming temperatures combined with the drought conditions are major factors that help to increase wildfires, and the rains that we have had in recent weeks is helping with the whole drought situation, but it is not mitigating or resolving the drought. We still have issues with that. Compared with the 1970s, the annual average Western US wildfire season is now about 105 days longer. It has 3 times as many large fires, larger than 1,000 acres. And we see more we see more than 6 times as many acres now being burned. Again, that graphic with the bars comparing 2019, the 5-year average, and 2020 supports that. Now, in this next slide, I actually took this a shot off of, I was looking at the news one morning, August 19th, and had a presentation about climate change, and I thought this was very apropos. And this basically was showing how the wildfires that had been occurring in the Dixie Fire, Caldor, as well as the other fires in Northern California and in Oregon have contributed to smoke. And this smoke can actually carry, depending upon where the wind blows it, it can carry it actually to even the East Coast. Or if wind is downstream, it can even carry it to the south. All right. Now let's talk about vector-borne diseases. And basically, if you hate mosquitoes, that's the topic, unfortunately, of this presentation, because those are the vectors that are responsible for most of the illnesses that we see when we talk about vector-borne illnesses. Diseases that are typically, these are diseases that are typically confined to warmer tropical climates and will spread northward in the northern hemisphere and southward in the southern hemisphere to higher elevations as a result of the warming climate. Just as a caveat, if you all remember when Zika was prominent, in Mexico, the areas of that country that had high elevations initially did not have Zika infections, but these mosquitoes are very adaptive, and they adapted to be able to operate in higher altitude elevation. So they're very smart in that perspective. If we go to the next slide, an increase in vector diseases in other parts of California and the world due to climate change could spill over into San Diego. And even with global travel, we can see this. So with climate change, we are seeing vector seasons lengthen. So the seasons are becoming longer, and then the temperatures are becoming higher. And this helps to support the longevity and an increase in the cycles for mosquitoes. Because of these conditions, the mosquitoes can complete their development cycles more quickly. Vectors persist for longer periods, and the range of the habitat as it relates to altitude and latitude, as I spoke about earlier, is expected to expand. Climate change will become more favorable for vectors in the areas that previously you didn't see these vectors. So again, that is how climate change is impacting vector-borne diseases. Now, if we look at, and this is just a list of all of the diseases that that are reportable to local health departments and that we see, and the Zika disease is bolded here is because that is the most recent disease that has been impacted or that we have seen. Now, we have seen the mosquitoes related to this disease, but we have not seen any locally transmitted or endemic diseases. Now, Zika was associated with people traveling to endemic areas. They get infected there, then they come back here. And because of the fact that we had the Aedes aegypti mosquitoes, those mosquitoes that are responsible for transmitting disease, they could bite people that were infected, again, infected elsewhere, and then spread it to others. These mosquitoes typically do not travel more than about a mile and a half from where they are located. So we went through that in 2017, I believe. Luckily, Zika it wasn't an issue like it was then, but it was because these mosquitoes are now identified in our local areas. If we can go to the next slide, I will talk more about that. So during the past 6 years, we have had 3 new Aedes invasive mosquitoes that have invaded San Diego County, and they're here to stay. It is doubtful that we'll get rid of them. They are aggressive, they're daytime biters, and they can potentially transmit many tropical diseases, as I showed you on the prior slide. But again, due to people traveling to other areas being infected and coming back here, and these Aedes mosquitoes can then bite those infected people and then spread the infection to others. All right, next slide. And this slide is a map showing us where these mosquitoes are. The Aedes aegypti and the Aedes albopictus were the first 2 Aedes mosquitoes. They were identified in San Diego in 2014 and 2015, respectively. These mosquitoes are not, again, native to California, but they can transmit the various diseases that I spoke to earlier. Again, Zika, dengue, chikungunya, as well as yellow fever. And there have been no recent cases of any of these diseases being transmitted in California, but we have to stay vigilant, and public health works closely with the Department of Environmental Health and Quality to ensure that if we have an infected person, particularly our last experience with Zika, DEH does an environmental scan to determine if there are Aedes aegypti mosquito around the home of an individual that might be infected. And that way we can stay on top of preventing the spread of this disease. Now, there's been a third type of Aedes, and it is called Aedes nodoscriptus. This is an Australian backyard mosquito, and it was first detected in San Diego in May of 2018. And then as shown in the map, to date this year, most Aedes detections are Aedes aegypti primarily. And I also would like to point out the fact, if you want to know anything about mosquitoes and the prevention strategy here in San Diego, you can go to our county's website, Fight the Bite, FIGHT-THEBITE, and that information, the website will provide information about what we're doing here in San Diego. All right. So the last 2 sections I want to talk about, the next one is what has the county done to address climate change in our region. So this is, I mentioned Cal Brace previously. The Brace project is actually a CDC model, and it is focused on 5 strategies. The first is to forecast climate change impacts and assess vulnerabilities. You heard me talk about You heard me talk about the vulnerability assessment that the state did about 5 years ago now for each of the 61 jurisdictions in the state. Then the second is to project the burden of disease in a region. The third component is to assess the public health interventions. So what's the burden? What are we doing? The fourth is to develop and implement a climate change and health adaptation plan. And then the fifth and last component is to evaluate the impact, look at the strategies that are being implemented and how are we improving the metrics that have been identified. So that is the basis for the brace model, and for California, we call it Cal Brace. So in the next slide, I wanted to share with everyone what it is that we've done to date. So for step one, which is looking at the assessing our vulnerability, we had the vulnerability assessment and profile report that's on our website. And it can be found at the state's CDPH's website as well. Step two is to project the disease burden. So we are currently, that is part of the vulnerability assessment, the health profile, and we are developing white papers. And we will be developing them for the 4 components that I've talked about. Again, heat, air quality, fires, and then vector-borne diseases. Number 3, assessing the interventions. Again, that'll be part of the whole white paper to document the activities that we've implemented. Number 4, same thing, but we are focusing on developing a San Diego adaptation plan. Actually, Jacquelyn and myself work with the state to develop a template for these adaptation plans so that we can use that to develop our local plan, and so that other health departments can use that information to develop their local plans as well. And as you can see on the graphic, the brace model, we implemented steps 1 through 3, and we are now working on our adaptation plan. And the 5th and last component is, again, the evaluation. So that will be our next step. In terms of in the adaptation plan, we will have specific metrics, goals, and objectives based on the information in the preceding 3 steps. And then after that has been developed, then we'll evaluate our process. So again, this doesn't happen overnight. It takes time. And we have been working very collaboratively with the California Department of Public Health to address this issue. We've been actually working on this probably since about 2015, 2016. Next slide. So these are the various partners. Obviously, CDC embracing the, no pun intended, but the brace model, and then implementing it through funding from the state that they get from CDC. And it is really a modest funding, guys. We probably got about $10,000 for about 3 years to work on this. And the entities within public health include our Office of Health Equity, that's Jacquelyn is the lead there, our Office of Border Health, Justine Kozo is our lead or director, and then our Community Health Statistics Unit. Many of you may be aware of Leslie Ray and her team, where they provide all of our population health data utilizing the San Diego estimates from SANDAG. And I just want to also kind of do a little aside here. Many of you might be aware that SANDAG just updated their estimates for 2020. That's done every year. It usually is done in July, but this year was done for last year in September. And we will be sharing this information with the public in the coming weeks, and letting everyone know how this impacts our data and our metrics that we routinely report. And then our community action partnerships, that we have a resident leadership academy where we train individuals from the community to focus on particular issues that they want to focus on. And climate change has been an issue for some of the RLAs. We have a vector control program, which I've already described through the Department of Environmental Health and Quality. And then our Office of Emergency Services, particularly when we have wildfires. And then they are a partner within our excessive heat response plan. And then Land Use and Environment Group, ditto for them. On the right side of the slide, The left slide were county partners. On the right side of the slide are external partners. And so I mentioned earlier the Air Pollution Control District. They are now a separate entity and no longer a part of Land Use and Environment Group. And all of the other partners, UCSD, SDSU, Scripps Oceanography, all of these are partners. You see them listed here. I'm not going to go through naming them all out, but this is a robust partnership, and a lot of work has been done with these partners to address this important issue. Next slide. I think I'm probably can end. Well, I do have one more section. Why don't we move forward, Lily? We are developing, if I can go back to that last slide. We have developed a PowerPoint presentation to go across all of the regions. We've conducted this presentation in East region of the El Cajon area, particularly. I know that COVID-19, it has everyone's attention, but our goal is to go through all of our regions, and any organizations that want us to come and present as it relates to climate change, we are open to doing that as well. And in the next slide, I talked about the adaptive plan that we are currently working on, our adaptation plan. So that is in progress, and our draft probably is about, I would say, 85 to 90% completed. In the next slide, next steps, we talked about these white papers. We want to develop white papers specifically for the individual components associated with climate change. We've given some presentations, particularly this year at APHA this month, and that got great feedback. So this is part of our next steps, is to develop these white papers for these topic areas, and this will augment our adaptation plan. And then the next section and last section is what can you do? Now, I actually provided, I thought is an important action that any organization can take. But in the next slide, we just wanted to give you some resources so that you can become informed and know what's going on in San Diego as it relates to climate change. And then I believe just one more slide and I'll be done. This again is information related to the various partners. We have a San Diego Regional Climate Collaborative, if you're interested in being a part of that. We also have a program called Partner, we as in the county, has a program called Partner Relay. And this was originally developed to communicate information to over 8 various language communities, including the threshold languages, is in addition to the 5 threshold languages in addition to 3 others, so that information could be translated in their language and pushed down to their communities. And so this group primarily is engaged when there is a disaster like a wildfire, but we found that to keep them engaged, it is important to communicate with them between disasters. So we continue to do that and provide, we've talked to them about COVID-19 and other issues as well. And then we have a San Diego Food Vision. The county, there are numerous partners involved in this. It's not a county project, but we are a partner. So because, as all of you know, climate change does impact our food chain as well. I didn't talk about that, but that is an important point. So I talked about cool zones. There's information there of where the cool zones are located. And the additional resources, Alert San Diego, if you want it as the Alert San Diego, this is a strategy or tool that Office of Emergency Services has, and you can register to receive emergency alerts. And I think I'll end there.
Well, thank you so much, Dr. Wooten, for a very informative and detailed presentation. It was greatly appreciated. And I want the audience to know that we do have time, about 13 minutes for question and answers directly for Dr. Wooten's presentation. So if you have a question that you would like to ask, if you could raise your hand, and we will call you as best as we can in the order that you have raised your hand. If you have put a question in the chat, I will check the chat also. So please feel free to ask questions. And in the meantime, while we're waiting for someone to ask a question, Dr. Wooten, in particular for these climate issues relating to heat, you mentioned that only like 42% of households have air conditioners versus fans. So with the climate crisis worsening and not seeming to get any better, what would be your recommendation for, or that folks get air conditioning opposed to fans, and how would that effort even be supported? Because I know it's not as simple as, you can take a fan, they're pretty portable, they're easy, to carry, but to say that, we need to especially get our vulnerable population air conditioning, what does that look like?
Well, because that's a challenge, and I don't have an answer for that, Jackie, in terms of what that would look like. But if there was, there's been all types of funding from the federal government. And we don't know what's going to come out of the funding that is now being massaged and engaged, so that we can get that Congress can approve. I believe climate change is included in that, but I don't know what that's going to look like. But based on the resources that we have available to us now, fans are the best that we can do, in addition to providing locations for cool zones. So where people can go and have exposure to air condition during the most extreme heat periods when we have these various alerts. Hopefully right now that's not an issue, because temperatures are not extreme. They're more on the cool side, but that is definitely an issue in the summer months, usually beginning in May and extending through October. So I didn't answer your question, Jackie, because I don't have an answer for you, but it is definitely one Joanne and I have talked about. So we just have to wait to see what's coming down the pike from the federal government as it relates to the climate change plan that might be proposed.
And I thank you for that answer. And I know as things are unfolding, because I know President Biden is having a tough time with getting his climate stuff and everything that's going on with his agenda pushed through. So thank you for that response. And I did want to take this moment before I forget. And I wanted to thank Joanne Julian, because she was instrumental in getting this event to happen through Dr. Wooten and Dr. Cheryl Anderson. There was a lot of connection and collaboration and coordinating of schedules to make this happen. So I want to thank Joanne, because we had a conversation, and I know how passionate Joanne is about the work that she does for the county. And she talked about heat exhaustion and heat exposure and heat stroke. And I said, I was experiencing some of those things. And so she went into detail, and she was like, we're talking about this presentation, talking about the work that you were doing with Dr. Anderson. And at that moment, it was like the light bulb went off for both of us, and we knew we had to make the connection to bring this to the community, especially, and this is leading into another question, I'm kind of like setting the pace for it, for communities of concern, communities of color, impacts of social determinants of health usually greatly affect them more than other sectors of the population. So how is climate change going to affect those same communities? How dire is it for those communities?
Well, I think based on the information I've shared with you, okay, having air conditioner is might be an impact of if you can afford to pay for an air conditioner. So that's a poverty issue. Being in neighborhoods, I talked about the vulnerable locations or populations, people that live in impervious zones. So that means basically those locations in the community that have no trees and they're mostly concrete. That's why I made the suggestion earlier about if there was a task that the NAACP wanted to take on with a health equity focus. I think that would be a laudable task to take on. But all of those are entities that are related to social determinants of health. If you live in an impoverished area, you're not going to have a lot of trees in that area. You're not going to have a lot. You may not have air condition, and there may not be a lot of locations you can go to that has air condition. So poverty, which is actually, I feel education and poverty and education are the greatest social determinants of health that impact downstream health of our communities and our nation. So I think connecting all of those dots, you can see that when in our communities that are impoverished or are not as, a good way to explain this is when we're looking at COVID-19, we look at services provided to individuals if they're in the healthiest quartile versus the lowest quartile. And we are able to identify across the county what those the lowest or the least healthy quartiles communities are based on the zip code and census tract. So we have that ability, and now we're looking at other things beyond COVID-19 to determine what's the impact to our communities. So at some point, we will be looking at that as well. And I have as a task or a personal goal is to issue a poverty report for San Diego County, and we are actually working on that as we speak. So those are some asides. Wasn't specific to your question, but I think overall that does answer your question, because we have to be able to look at our communities, assess who's vulnerable, and assess the burden. And we know that chronic diseases, heart disease, asthma, heart disease, asthma, diabetes impacts our people of color at a greater risk than it does others. But it impacts the white population as well too. Heart disease, for instance, while Blacks are number one, whites are number two. So I think we have to look at it. We have to bring everyone up to the same level so that no one is left behind.
Thank you for that. I have a few questions from the chat. Particularly Robert Vargas Belcher says, Dr. Wooten, thank you for a great presentation and outlining the areas that affect our county. I am curious what efforts or strategies is San Diego County doing to address adaptation in communities that are disproportionately affected by climate change? I think you pretty much answered that question, or did you have more to add?
I don't have anything more to add. I mean, it would be, all of this is contingent on resources. And as I shared with you, what we've done to date has been done on a shoestring. I mean, we've gotten $10,000 for just 3 years. So I think between 2016 and 2019. So yeah, certainly more funding from the federal and state level is needed to address climate change issues, and so that we can have more staff. Our climate basically, Joanne is part of what she does is climate change. She's our lead for health equity, and we have another Ariel Hamburger also works on climate change, and then Isabel, but it's only small portions. We don't have dedicated staff where that is all that they do, and we have to get to that point at some point. Certainly climate change, and I didn't mention any of that, but climate change is a priority for our Board of Supervisors. So we will have to look at what that brings in the coming months to years.
Thank you. Getting back to the chat. What are the best resources? This is from Diane Lopez Hughes. What are the best resources for acting to mitigate climate change? Is the NAACP working on such programs? How can we support President Biden's efforts to reduce the impact? So I believe the first part, what are the best resources for acting to mitigate climate change? It's for you, Dr. Wooten. And so we'll let you answer that question.
Well, in the little 7th section of my presentation, what can you do? We provided resources, and actually we have a lot of, we can provide that information. We have a lot more resource information we can provide, but we provided that. The second, I think there was a 3-part question. Again, I keep trees in our communities, I think is an important thing. So, and then letter writing campaigns is always important. When people want to see something change in the county, they send letters to our board of supervisors. So I'll just end with that.
Okay, and I have one final question from Ms. Brown.
Oh, but can I just say, I'm not
Sure.
asking people to send letters to the board of supervisors. That was related to the federal government.
Okay.
So NAACP as an organization, I just want to be clear about that. NAACP as an organization could partner with other NAACP organizations, and whether it's in Southern California or California in general, expressing their concern and interest to the federal government to address climate change.
Okay, thank you for that clarity.
Thank you.
So the final question is from Ms. Brown, and she's asking, how can your local NAACP, specifically those out of state, contribute or provide resources, even a voice to these concerns?
I have a suggestion.
Sure.
I mean, developing, and there are a lot of toolkits out there about what people can do, but as an organization, maybe there are some things that you can promote internally as well as across other organizations, other NAACP organizations that you can do collectively. And you know what the whole collective impact. One person doing something, one organization doing something is great, but if you have multiple entities doing the same thing, you will see the collective impact of those actions.
And I totally agree with that. And so we're at 2:59, and if you want to go ahead and do a little stretch break right now, stand up. Thank you, Dr. Wooten, for everything, for all your information, your insights, your expertise. We greatly appreciate it. And we're going to keep this ball rolling. Right now, we're going to be moving into the introduction and the bio for Dr. Anderson. But if you want to go ahead and stretch, you have like maybe a minute before we get started. Thank you for all the comments that were in the chat. I can read a few of them. And my daughters are on here. My daughter commented that they have the same mosquitoes, and she's in Arizona. And Alicia says, and she's in Atlanta, I agree with identifying that task as an action step. Mm-hmm. And I wanted to thank everyone who came on and joined this conversation from wherever you are. Mr. Bonner says, is HSA working with the city and county on their environmental and climate justice elements of their general plans? So we know that the city of San Diego has their CAP program, but I think what he's asking is there any collaboration between the city and the county? So
that slide that I showed, I don't know if the city was on there, but I do know that this regional collaborative, I'm not 100% sure of the city, but I'm pretty close that they are a participant. Let me point out that LUGE, Land Use and Environment Group, is the responsible entity for the County of San Diego at developing the Climate Action Plan. So great point. We will find out what that collaboration is and get back to you. So I cannot say for 100%, but I would think that there is cross collaboration, yes.
Thank you so very much. And without further ado, I'm going to introduce you to Dr. Cheryl Anderson. She is a professor and dean of the Herbert Wertheim School of Public Health and Human Longevity Science. Dr. Anderson received her doctoral degree from the University of Washington and her Master of Public Health degree from the University of North Carolina at Chapel Hill. At UCSD, Dr. Anderson is the director of the UCSD Center of Excellence in Health Promotion and Equity. Dr. Anderson is a fellow of the American Heart Association and is the chair of the American Heart Association's Nutrition Committee and vice chair on the Council on Epidemiology and Prevention. So next up, ladies and gentlemen, and however you identify, is Dr. Anderson.
Thank you so much, Jackie, for that great introduction. Thank you to the organizers of this really important conversation. And I just want to acknowledge Dr. Joanne Julian, who is a part of our Center of Excellence for Health Promotion and Health Equity. We have really enjoyed having her in that space. I also want to acknowledge my colleagues here at UC San Diego, Dr. Tariq Ben-Marnia and Dr. Sasha Gershanov, who Sasha, I think, is on the call right now with us. So hi there, who, really keep me grounded and up to speed on the issues that are happening in this space. And thank you, Dr. Wooten, for that just really informative presentation about what's going on here in San Diego. I love this idea that we're going to rise to the challenge and answer the call, right? Because in the 21st century, this is clearly one of the biggest challenges that we have. And we have a real opportunity because our nation is talking about health equity in a way that I've not seen us talk about it in my lifetime. And so I think that, as we talk through these issues, I love this idea of going really upstream to try and figure out why we're in the situation that we're in today. Because racial inequity, it looks the same across systems, right? And socioeconomic differences matter, as Dr. Wooten pointed out. Poverty and educational attainment really does matter, but it doesn't always explain racial inequities, and they're caused by systems, and these things have been historically built in our country such that organizations like the NAACP remain relevant today. So I just want to say thank you all for tuning in, and I want to talk about an equity angle on what we're dealing with regards to, really, it's about environmental justice. So I'm going to go ahead and share my screen. Is that okay, Jackie? All right. All right, so this is a really important issue, and I'm so grateful that I have the advising of some really brilliant scientists here at UC San Diego. And I just want to start with this slide that really highlights the health impacts and inequities that we have here in San Diego, showing the average hospitalizations that are attributable to heat by zip code for San Diego. These data were captured from 2004 to 2013. And it highlights just how uneven the burden is borne out across our beautiful town. The next two slides really help us think about the main mechanisms by which this might be happening. So what can explain heat and health inequalities in San Diego? Well, there could be an issue of differential susceptibility, right? Where individuals have pre-existing chronic conditions or occupational heat stress. And, we're talking about outdoor jobs, for example, working in really hot environments, firefighters, bakery workers, farmers, construction workers, as Dr. Wooten already pointed out, places where there's a lot of concrete and not really a lot of trees. Differential exposure, maybe these micro kind of heat islands. And we shouldn't undervalue the importance of redlining that has really put us all into certain parts of certain communities and continues to impact how we experience health outcomes across this town and across many towns in America. So we're not all equal in the face of extreme heat. And this is really a multi-level and structural issue that forces us to think about the social determinants of health. So when you see this graphic, you see that there are, of course, individual lifestyle factors, including our age, our sex and gender, our kind of our genetic makeup that's going to matter for how we experience health and how we face the extreme heat circumstances. But the social and community networks around us also matter. Our housing. We've already heard whether or not within housing we have access to air conditioning. What about our community networks? Do we live alone? That could be a real driver of heat-related experiences. When we think about neighborhoods, do they have access to green spaces, to cooling centers? And within a policy context, for San Diego, we happen to have one of the best health departments in the country. But do people live in cities or counties that have existing heat action plans, for example? So these, again, are some of the factors that are going to come to play when we're thinking about inequities and inequalities. As a public health scientist, we think about persons, places, and time. And the epidemiologic literature, which is the fundamental science of public health, tells us quite a bit about heat-related vulnerability. On my screen, you see the title of a review article by Dr. Tariq Ben-Marnia and his colleagues, really discussing the vulnerability to heat-related mortality. This is a systematic review. It has a meta-analysis component and a meta-regression analysis component. And I'll show you some of what emerged when they looked at the ratio of risk ratios here. This information about vulnerability has been getting a lot of traction. It's being used in guidelines at the World Health Organization, here at the EPA, the Environmental Policy Agency, and Health Canada, for example, and in our local heat action plans. So this first graphic is about what happens when we look at the ratio of risk ratios, comparing individuals who are 65 years old to people who are, or 65 years or older to people who are less than 65, and the quantity of differential susceptibility that we see here. For those who are trained in public health, you'll know that once the line of unity here is at 1, and when it goes over 1, we're talking about an increase in risk. When the line is overlapping the confidence intervals, the risk is not significant, but nonetheless, we could see a real trend here where most of these studies are showing signals toward older individuals really being susceptible. With regards to that earlier conversation we were having about socioeconomic status, here are the data regarding SES. It's really thinking mostly about education, occupation, and income level. Again, trending toward SES really being an important factor for thinking about outcomes in the space of inequities. Going back to the issue we raised earlier around why are communities of color disproportionately impacted by these environmental conditions, you can see here by Karina Gronlund, this graphic shows us the multiple determinants and how important it's going to be for us to work at a sort of multiple stakeholder and bringing many, many voices and skill sets to the table to solve this issue. We've got medical concerns, we have emotional and mental health concerns. We've got issues around social organization. So it's not just biological or mechanistic, we're also having to think about social structure and behavioral issues as well. Here are data from the Gergiuses and colleagues, where they look at health-related vulnerability in San Diego. And these examples show us that by age group, average daily hospitalizations for heat-related vulnerability goes up as individuals age, and air conditioning is a really important factor. Being exposed to higher conditions without being able to mitigate it, having lower AC saturation matters again for our average daily hospitalizations. When we think about the impact of heat wave among persons who are experiencing homelessness in San Diego, we've got a serious justice issue here. Here in the Schwartz and colleagues article, they asked the question, what's the vulnerability of persons who are experiencing homelessness to the health effects of heat waves, and what characteristics make them particularly at higher risk? And they were found to have an increased odds of an emergency department hospitalization during a heat wave, being admitted with psychiatric notes, being young or elderly, of Hispanic ethnicity increased their vulnerability. So the implications here for not only us as a whole community and how we want to advance what Dr. Wooten and colleagues are trying to do across the entire county, we really need to think about our most susceptible citizens, those who are remain most vulnerable and in the greatest need of services. So what are some of the things that we can think about in terms of solutions to reduce health-related, heat-related health impacts? It's, I'm really impressed with the growing characterization of the state of affairs, which we need to do, right? We need to have data to put into those letters that we're going to write to Washington. But at the same time, I think we also as a community are we have an opportunity to really help guide what the solutions might be in these circumstances. So green spaces have been analyzed, I think, pretty robustly, and are really related to reducing local temperatures and helping to prevent heat-related illnesses and death. And as these data continue to grow, we as informed citizens really need to push forward the policy levers that we have access to ensure that these data are getting disseminated and findings are being implemented into communities. Sometimes it just takes way too long from the time the science gets curated to when we can actually take some action on it. We also want to be mindful of the fact that we have heat-related instances, illnesses and deaths happening differentially across neighborhoods right here in our own town. And a part of that is historical. And, we can, however, try to disentangle ourselves from some of that history once we acknowledge it and remind people of why things are set up the way that they are and really pursue this from a justice angle. We also want to, think about how, as we try to bring in interventions such as green spaces, we honor and look back at some of the things that have happened in our towns in the past, and not try to take this as an equal, movement across town. No, there are going to be places that have greater need because of the historical disadvantage that has persisted over decades. Here we see just sort of more support for green space as an intervention to decrease heat-related inequalities. These data come from Hale and colleagues, and using thinking about access to green space isn't random. Again, we want to make sure that as we think through our interventions, we simulate how multiple greening of spaces and identifying the zip codes that could benefit the most from those interventions come into play. You saw these data earlier where the burden is not borne equally, and the intervention support should also be given to the communities most in need, with a lens toward trying to really acknowledge a lot of what we've experienced in the past. We had Dr. Wooten talk a bit about climate change. It's a context, right? We've got exacerbating, resulting existing weather conditions because of climate change. It's also created unprecedented situations where we have more humidity and nighttime heat waves. It's making the challenge around environmental health a much bigger issue than it would be otherwise. So we have to keep pushing again for policies that are going to keep climate change at the front of the agenda, whether it's big P or small p. We have to keep this top of mind, remind people that this is real and not simply a hoax as some would have us believe. So here's a slide that I want to close on that represents the links between climate change, heat, and population health. We can see that there are direct effects from climate change. We see storms, drought, floods, heat waves. There are indirect effects. It impacts our water quality, our air, how we use the land, ecological changes. And then there are, of course, social dynamics that impact how we interact with these direct and indirect effects based on our age, our gender, our health status, our socioeconomic status, whether or not we have access to social capital, the public health infrastructures around us, our mobility and level of conflict. We happen to be also a border town. Are we migrating? Are we in refugee status? Those things will matter. And they have a tremendous impact on our health. We know that health isn't just about physical condition, it's about mental and spiritual condition as well. And so we keep an eye toward those broader impacts of health outcomes. So I will stop here and say thank you so much for the opportunity to talk through some of these issues with you today. And I look forward to fielding questions.
Well, thank you, Dr. Anderson. You finished well ahead of the time that we allotted for you. I found it to be very informative and similarities, of course, with what Dr. Wooten said, intersected with what your presentation entailed. And so, of course, I do want to delve into the fact that the redlining map that you showed, I've seen that map in so many scenarios, it's not even funny. It's in the map for health disparities, anything that is affecting, I'm not happy about it, but I'm just like excited, like I've seen this so many times, but it's always in a negative connotation for people of color, communities of concerns. That same exact map, it's used for the redlining, it's used even now for the redistricting, it's been for all the health disparities. So how do we as a community, what is our part? We already know what the experts like you and Dr. Wooten and Joanne and anyone that works in public health are doing, but what is the charge for people, everyday people? I'm an accountant, but I have a passion to learn about this, about climate change and about other things that affect the environment, but everybody doesn't. And a lot of people don't pay attention to these things. So based off of your experience and your expertise, what is the charge for the people? What do we need to do to help ourselves, essentially?
Yeah. So, in public health, we have this framework that we use called the Socioecological Model. And the individual sits squarely in the center of that model. When I teach it, pardon the metaphor here, but I haven't found a better one. When I teach it, I will often say, it's your genes that load the gun, but it's the environment around you that ends up pulling the trigger for how your health unfolds over the course of your life. And so I'm always very cautious about putting things squarely on the shoulders of individuals, because yes, right, what we do, our behaviors on a day-to-day basis matters, but we need structures around us that help us have healthier choices be the default choices. And we need structures around us that support the kinds of health outcomes that we're going to have with regards to how we experience environmental health, climate change, and the various issues that are wrapped in within there. So I think for all of us, one of the things that matters is how much demand we create within the environment around us to get people to pay attention to the things that we care about. So number one, any big initiative such as this sort, the lift is so great that we can't rely on the health department to do it by themselves. We can't rely on the NAACP to do it by themselves. It's really a convening of all of us, and it's in everything that we do. It's every single day, and it's all the time. And particularly when there are inequities of this sort, those of us who are privileged, right? We don't really have an incentive to necessarily think about these things. We have trees. Look at behind me, right? There are trees behind me. I'm in my office in La Jolla. Not that, sort of concrete space that Dr. Wooten was talking about earlier. So the charge for me has to be bigger than the privilege of sitting in, an office such as this sort. It really has to be caring for our community, thinking about how we, for right now, capitalize on this time in our history when conversations are happening that were not happening before, and wanting to, as a larger unit, really move some of these issues forward. So I say, first of all, we raise awareness. And that doesn't have to be coming from the County Live Well San Diego initiative. It can be me to you, right? And so in all of the spaces that we're in, every single person on this call, talk today, talk to your family, talk to your friends, talk to your coworkers, wherever you live, learn, work, play, pray, raise these issues so that awareness is raised. We know that is not going to do it alone, right? We're going to have to think about how to mobilize and build coalition around these issues. So in the spaces where you go to problem solve, again, raise these issues in a community context so that we can put more than just our individual brains behind this. But I love that you raised this question. And yes, we all have a role. And we also need to have an infrastructure around us that's going to break this cycle, this really detrimental cycle of injustice, where things continue to compound on individuals who for a century have been already so heavily burdened.
Thank you. And we can take questions from, thank you for that very, very detailed audio response. And I asked that specifically because I know that when you're doing environmental and climate justice work, and about the other injustices that are happening racially, you tend to get weighed down. It's like so much pressure. It's like, when do we get a break? When do we get to breathe? Oh, we don't get to breathe because we can't have clean air because of proximity of where we are to pollution. Oh, the trucks are going to come through the barrio. So it's like a continuous wheel of pressure and trying to always fight for justice. And if it's not in one area, it's another. So with health, and then we have high asthma rates, we have high diabetes rates, we have high hypertension rates. And then on top of that, we want to go out and take a walk, but in certain communities, taking a walk is not ideal because of the air quality. Mm-hmm. But we're encouraged to exercise, even like riding a bicycle. So those type of things is like continually being behind the 8 ball, I guess. But I'm gonna stop right there and see if anyone else would like to present a question to either of our panelists right now. We have time. We're scheduled to go to 4 o'clock. Of course, we can certainly wrap it up early. Who doesn't like that? But while we have their attention and while they are here, if you have a question that you would like to ask, there's no question too silly. Please go ahead and present your question by raising your hand. And I do see Dr. Robinson on here. Dr. Robinson, I'm calling you out. He is the chair for our health committee for the NAACP. And I know that in that brain of yours, you might have a question or even a comment.
Well, certainly I have a comment, one of which is that given the issues that we face in terms of housing in San Diego, given the issues of land use, given the issues of trying to bring green to the neighborhoods, how are those people who impact that intersecting with what you talked about in terms of how we should then try to mitigate the effects of heat and climate change? That's I can't see that happening because developers want to build. And so maybe you can answer those issues.
Yeah, so those are big issues, and I'm going to hope Dr. Wooten will weigh in here as well. But as a public health scientist, with my work being in epidemiology, and I've mentioned before, we think about persons, place, and time. Never before in my career has place mattered so much. And I know that there are conversations happening here in San Diego, particularly I was a part of one at the Childhood Obesity Initiative, for example, where urban planners are coming to the table with the scientists to really better understand what the issues are and how decision-making that happens in the space of housing ultimately play out in our adverse health outcomes, our experience of adverse health outcomes. And so that's a really great place to start, is we really cannot be trying to fix these massive issues without bringing the stakeholders to the table. And I love, Jackie's earlier question, because everything overlaps. And when it comes to dealing with environmental health issues, the compounding is significant. Right. So, for the issues that the NAACP works on, we've had this long history of things that we've, taken with us as, people of color over time. And we have the modern day contemporary issues and exposures that are coming our way that too are now happening because of climate change in fashions that we have never seen before. So I think that, again, none of us can take this issue on alone, and we must sit at the table with our urban planners. And I think that there's a movement in our town anyway toward that happening. Last fall, for certain, we were in again, the childhood obesity space, having these conversations. Dr. Wooten?
Yeah, I'm always of the perspective is that we are the change that we want to see happen. And not relying on somebody else to do it. The agitator, the accelerator, I think we all have to be that. So that's my response. I mean, I just think that there's so much that this organization can do, and also work with others. But keep in mind that no organization can do everything. I go back to the collective impact. You have to figure out what is the one or two things that are most important that you can do and that you can work with others to do. And Dr. Anderson is absolutely correct. There's a lot of momentum in San Diego, but San Diego is only one of 58 counties in the state. And the state is only, it has to be something that there has to be a movement or a momentum. And there are some things we know that work. So I think we should try to focus on what those things are and work with others to try to achieve them. And the green space, I just think is very important. And I just think it's something that multiple organizations can, and there's funding out there that people have there's funding out there that you can go after. And if you don't apply for, it's like what, playing the lotto. If you don't play, you don't win. So if you don't apply for the funding, you can't get the funding. So there are definitely opportunities.
How true. But how does that impact how we are using space in this county? And what changes have you seen coming forth in terms of how we use space? Talking about, we don't have low-income housing. The average price of a house in San Diego County is just a little less than $1 million. And it's gone up 26% in the last couple of years.
Dr. Robinson, I can't, and none of us can answer all of those problems. You got to look at what can you do. That's the one way I've gotten through my job. I try not to worry about things I cannot personally change. Mm-hmm. And because otherwise you will run yourself crazy. Now, if you can work with others to make those changes that you're talking about, go for those opportunities. I don't have the answer for that specific question about spaces. That's kind of above my pay grade. My focus is on
that.
I'm just being very honest with you here. But engaging the policymakers, I mean, And I'm not trying to tell you guys what to do, but engaging the policy makers on issues that are important to you. Whether you can do anything about it as an organization, and as I believe Dr. Anderson said, the first thing is we have to identify what are the issues that are important to you and who are your allies. And then it can be, it's like eating an elephant, you small pieces at a time. And there are small things that you could do to address that issue. I don't have a specific answer for you. I just have a strategic approach, a process by which to address it.
The issues that we have to address are policymaking issues for the most part. And policymakers can't come to terms of what they want to do, even in Washington, D.C. So the momentum that we need certainly needs to start there in terms of seeing what the climate change strategy is going to be directed from the top, and then what things are taking place in the county of San Diego. And then we know of what you presented, okay? And then we have to look at it from an equity perspective, in that those areas that you outline that have the most, they're most impacted, then how, with your help and guidance, do we develop those strategies to take care of those areas that seem to be neglected no matter what happens?
Well, I think that earlier in her presentation, in her comment, she did mention how that on one of the resources, that one of her last slides was how we can join in, I think it was the community.
Regional collaboration, I believe, yeah.
Yes. So I'm just interjecting in there because I appreciate, I know Dr. Robinson has a passion and he's a very deep thinker. And I know that he could go, he can go on and on with his questions because he has a passion for that, and because he knows data like Dr. Anderson does and like you do, Dr. Wooten. But I just want to kind of steer it in another direction real quick, because what I wanted to ask is that from Dr. Wooten and Dr. Anderson is that what I want to know what else we could do is if we could ask your staff to come do something similar like this to keep this conversation going, because we don't want it to be a one and done. We want it to be informative. We want people to be become more knowledgeable, and we want to keep it fresh in the mind so it's not like a fad. So are we able to like contact and reach out to your staff to say, hey, would you come and would you speak and do a presentation at maybe at one of our committee meetings, because we have several committees, but for me, for the Environmental Climate Justice Committee, I'm reaching out and I'm reaching to the experts. I want to have these conversations. I wanted to get to the people so that they understand the seriousness, the impact, that we don't have time to wait. Dr. Anderson mentioned urban planners, and we were talking about that earlier, or with a previous colleague about urban planning. And we know now that where communities are concerned or located geographically, that's going to shift. That's not going to be the same. Like who's in that community now, 5-10 years from now, are not going to be there. So we don't have a lot of time. We don't have time to like necessarily go through the whole bureaucracy part of it. We respect it, but we understand that we really have to kind of shake the tree now. So we want to be able to reach to the experts and have, even have you all come back again at another time on another topic, so that people understand like, oh, Dr. Wooten's coming on, Dr. Anderson's back. We have to listen because it's sounding the alarm.
Jackie, I think it's important though to note that gathering information is part of the process, but at some point you have to make a decision and act. You have to prioritize what's important for you. Again, there's a lot to work on. There's a lot to work on for the health department, but we have to prioritize. And so I'm saying that the same thing for organizations, developing your strategic direction and focusing on what that is, and be the accelerator to make change. And change doesn't happen overnight. But I think you have to decide on what your actions are going to be. And then solicit the help to do that and partner with other like organizations, other NAACP organizations in Southern California, in the state of California, or across the nation.
Well, I'm going to make one more comment and then I'm going off to the epidemiology section of the county to listen to their report today. But the good thing is that we have people like yourself, Dr. Wooten. You and I have known each other for a long time. And I've not met Dr. Anderson yet. I will. But I'm glad that you're in the positions that you're in to bring attention to these issues, because you have to bring attention, those issues to the attention of people that look like us, because it's important. It's important for everyone. And I'm going to sign off. Thank you guys very much. It was very informative. Do come back again and again and again.
Thanks, Dr. Robinson. It's really good to see you, and I look forward to meeting you in person.
Certainly.
Thank you. Thank you, Dr. Robinson.
Thank you all. Thank you, Dr. Robinson. Does anyone have any questions? I don't have to keep you here. We appreciate you taking time from your busy schedules and, basically in the middle of the afternoon to attend this event. We hope that you found a lot of it useful.
Jackie, your volume went off.
I muted myself. Sorry about that. We hope that you found it useful and that you'll take it back and share it and talk about it, like Dr. Wooten said, and like Dr. Anderson said, is that now there's no reason for us to keep this a secret. We have to, I forgot the word, where you work, play, and pray, I think is what Dr. Anderson said. And Dr. Wooten, you just heard her rebuttal to Dr. Anderson. So we have to be about it, and we have to pick what's important to us and focus on that, because it is a lot. So without further ado, President Maxwell, are you still on? Or Vice President Bonner, did you want to have any comments?
Yes, yes, I do. President Maxwell asked me to give the some party comments because she's not able to drive and talk at the same time. So basically, on behalf of the San Diego NAACP San Diego branch, thank you to Dr. Wooten and Dr. Anderson for sharing your time and expertise on the issue of public health and climate change and the impacts here in San Diego County. I'm going to be putting some stuff in the chat because I'd be remiss if I didn't provide you the opportunity to join NAACP San Diego branch, or if you live outside of our catchment area, you can join in the area where you live. And then also I wanted to announce that the next meeting of the Environment and Climate Justice Committee is Tuesday, November 2nd at 6:30 to 7:30 p.m. And the Zoom link for that meeting will be going into the chat as well. Again, I really want to thank you for taking time in the middle of your day to share with the really critical information with us, and also providing the support that our community needs. So thank you very much.
Okay, thank you so much for those final remarks. Dr. Wooten, Dr. Anderson, did you have any final remarks? We can wrap it up after that.
No remarks here.
Okay.
Yeah, I just want to say thank you for having me. It's a really great opportunity for our new Herbert Wertheim School of Public Health and Human Longevity Science to be a part of these conversations. I think a school of public health in a community should be thinking through and talking with the community about these things. Again, I feel so fortunate to live in a county where our health department, if you ask me, bar none, is one of the best in the country. And so we can definitely continue to figure out what we can control and what we can move forward so that there's some action that can take place in this space.
Thank you so much.
Well said, Dr. Anderson.
Okay. And so again, I want to thank Joanne, and I also, Dr. Anderson, please let Tariq know that I thank him also. They worked, I want to say tirelessly, collaboratively to coordinate you and Dr. Wooten's schedules. They followed up, they did more follow-up, and were very, very instrumental in having this happen. And then to see that you read one of his slides and that he is a doctor himself, I'm like, oh, okay. I didn't know that about him, but I was very happy to work with both Joanne and Tariq. And also want to shout out to Lily, who is, she cracks the whip to get things done. And so thank you, Lily. And we talked, and so we have an understanding, and I understand your work ethic, and I appreciate it. And thank you to everyone who tuned in, my daughters and my adopted daughters who joined in. They're from Atlanta, Georgia, and Arizona. I'm grateful. And I also want to make one last point that Dr. Wooten and Dr. Anderson, this did get sent to our state NAACP as well as to our national ECJ committee members. And so they were very excited and mentioned that this could be a model for what other branches or people can do. So I wanted to thank you because I knew it was important, and I knew I was excited when Joanne and I were talking. I was just like, this has to happen. And so she went to work on it, and then before I knew it, she was like, yeah, Dr. Wooten, yeah. You know, Joanne and her Canadian accent stuff. So I'm happy to be able to have been in the position to connect with her. So thank you, everyone. I don't have anything else. Go ahead and enjoy the rest of your day, and stay tuned for more that come from the NAACP San Diego branch.
Thank you, Jackie.
Thank you, Jackie.
Everyone.
Welcome. Thank you so much. Take care, everyone.